Welcome. For those of you that don't know me, my name is Jerry Williams, and I am the founder and president of Myositis Support and Understanding, the organization that hosted the FDA Listening Session on Adult Dermatomyositis. And we're so happy to have you join us today because the power of our voice is just phenomenal. And today you're going to hear how the power of the voice of 8 people, ultimately, not all of them could be with us today, but how the power of their voice helped educate the FDA about the differences in the different types of dermatomyositis and why that's important. And Lynn is going to tell us all about what an FDA session is, and we'll go through that so that you get an understanding of these types of things. Before we get started, I would like to take a moment of silence, if we could, to honor and remember the victims of this Texas shooting that happened. If we could all just take a moment of silence, please. Thank you. And let us all be thankful for who we have in our lives. We never know what tomorrow is going to bring. So thank you. It was a beautiful moment. So I'm going to kind of get us started today by turning it over to Lynn Wilson, who is going to, like I said, she's going to help educate us about what this FDA listening session was all about, what we were trying to accomplish, and what we believe we did accomplish, and very well at that. So Lynn Wilson is our vice president, as you might know, and the director of our patient-centered research. And also joining the patient-centered research side is our chief science officer, Rubinowitz. So I'm going to turn it over to Lynn. So Lynn, welcome, and over to you.
Thank you, Jerry. It's a pleasure to be here with everybody. So I just wanted to do maybe 10 minutes and go through, give you some context on the FDA listening session. So next slide will show us our agenda. So I'm going to tell you a little bit about what is an FDA listening session and what it is that we wanted to achieve with that session. And then we'll do the introductions and acknowledgement of the speakers. And then we will break into just casual conversation where we'll hear from our speakers and ourselves, because we learned a lot. I know I did learn a lot. I learned a lot working with this wonderful team. Kind of a look behind the scenes at how we got to the point of hosting this session, and then telling our stories, what we learned there. So next slide. Okay, so what exactly is an FDA listening session? Well, it's defined as a non-public, in other words, a closed session just between FDA staff, patients, caregivers, and their advocates. And it's set up to facilitate sharing of the patient's stories, to talk about the disease burden, treatment burden that we experience through our myositis journey, the impact on our daily lives, and priorities that we feel need to be considered as they look at medical product development. Next slide. Now, this is a question that we've asked, that other people have asked us: why in the world adult dermatomyositis? Well, there are a couple of reasons. Number one is that and this is actually a good indication of the symmetry within the myositis space. We had CureJM did a session on juvenile myositis, I'd say a couple of 3 years ago. TMA did a session a couple of years ago on IBM. So it seemed to fit. If you look at what's going on in the myositis space, and you look at all of us collaborating as we can, it seemed to fit that as this issue popped up, that adult dermatomyositis was next on the list. And the reason for that is very simply that we have had several failed clinical trials recently in dermatomyositis. And there was a feeling within our community that the we needed to convey to the FDA more about the heterogeneity of dermatomyositis. And we all know what that is. We all have different symptoms. We present differently. We have different treatments. We're all at different stages. So there is not a one size fit all answer to what we do with research or in clinical trial design. One of the first things we wanted to do was make sure we highlighted the severity of complications and the impact on patient quality of life, and underscore the lack of effective treatments. And in our case, we tried to make the point about the need for personalized care management. In another light, and I think you'll understand this too, is we wanted to highlight the impact of physical pain associated with dermatomyositis in conjunction with, of course, what we've already found out in our pain study, which is now published in Rheumatology magazine. And finally, as we talked before, to underscore the need for clinical trials that are clinical trial design that's based on what we know is a diverse dermatomyositis manifestations. Next slide. So with that, what I'm going to do now is introduce, in our small way, the speakers who made this all possible. And what I'd like to start with Kathy Shea, who is not here with us. She actually was not able to be a speaker at the session because she was in the hospital. And she's currently, as far as we know, under palliative care. But Kathy's story, and I'm just going to keep this quick, and Kathy's not here, but so I'll say hi for Kathy. Kathy is a nurse on disability in Spokane, Washington, and I spoke to her story, and it's one about her journey with refractory dermatomyositis that has left her wheelchair dependent with pain, skin involvement, and lingering muscle weakness. The next speaker that I wanted to just highlight real fast is Dana Araujo, who is, and I hope she doesn't mind me saying, are you still 23 years old? Dana, just give us a shout right now. Hi.
Hi, no, I just turned 24.
Oh, okay. Well, happy birthday. Okay. Dana's from California, and she has MDA5 antibody. And her story was the challenges that she faced in her journey with getting her college degree and moving on into what she hopes is a law career. And she described to the FDA her journey with weakness, pain, skin rashes, and facial edema, and also talked about the emotional toll that it took on her.
So I would like to quickly introduce Suzanne Belmonte. You might know Suzanne from a webinar that she did about dysphagia. She's a former speech pathologist from New York with the NXP2 antibody dermatomyositis, and she has the cancer associated with non-Hodgkin's lymphoma. And she shared about the severe fatigue, lingering pain and weakness. And she talked about treatment side effects and losing the job that she loved and the changes in her family life. And we'll hear from Suzanne in a little bit. Suzanne, welcome.
Hi, everybody. Well, thank you very much. I'm so honored to be here.
So glad to have you here, Suzanne. Thank you. And next, I'd like to introduce my dear friend, Fred Lazenby, who is in Virginia, anti-Jo1 positive dermatomyositis anti-synthetase syndrome. And he talked about his DM-related arthritis, interstitial lung disease, and pain while seeking treatments and participating in clinical trials, all while caring for his parents, which we know living with myositis and being a caregiver, tremendous. Welcome, Fred. Thank you for joining us.
Thank you, Jerry, my good friend. I'm glad to have been a part of this. Thank you for everybody, and God bless.
Thank you, Fred. Us too, and we'll hear more from you in a little bit. And now I'd like to introduce Sarah Schaeffer. Sarah is a young mother in Kansas with the MI2 positive dermatomyositis who has struggled with muscle weakness, skin sensitivity, fatigue, and calcinosis. And she talked about the impact on her health, family, and professional life. Sarah, welcome, and thank you so much for joining us.
Hi, everybody. Thanks so much. I'm glad to be here.
Glad you're here with us. And now I would like to introduce Melissa Gilbert, a mother of two, including a 4-year-old who is just a little darling from Georgia, diagnosed with refractory MI2 dermatomyositis. And she talked about her journey with DM-induced pain and weakness and shared how dermatomyositis has impacted her family life, mental health, and finances, and the need for better treatments for all. Melissa, you are an amazing woman. Thank you so much for joining us.
Oh, Jerry, thank you. You're too kind as always. And yes, so glad that everyone is able to be here today.
Thank you, Melissa. Glad you're here. And we'll hear more from both of you soon. And now Linda Rubinowitz, a new grandmother and a mother of 4. She was a rising star in her sales career until anti-Jo1 positive DM antisynthetase, even I have trouble pronouncing it sometimes, antisynthetase syndrome entered her life with lung disease, muscle weakness, pain, all refractory to treatment. And she'll share about her failing health due to constant flares and flare cycles. Linda, thank you so much for being a part of this. I'm so glad that you could join us today.
Hey, everyone. I'm just so happy to have taken part in this.
Thank you. Thank you, Linda.
Finally, our last speaker was a caregiver. Some of you know of the Myositis Empower Walk, and Gladys was Bob's wife. And of course, she's a mother of 3 wonderful children, and her family was on a desperate search to find a cure or treatment for her husband. Unfortunately, he passed away before he could see a specialist. And the family started to deal with their grief and to start the healing process, of course, started the Myositis Empower Walk in memory of Bob, her husband. And with that, and Gladys is not here, but with that, what we want to do is just give our speakers a big round of applause. So if you're there and your mic is on, just bravo. Bravo to everything that they did.
Yes, yes. Thank you, thank you.
So next up, what we're going to do now is open it up to discussion. And I'm just going to start out by talking a little bit about the kind of the behind the scenes. And everybody should chime in because I know we all have probably little snippets to share here. Some of the highlights, and I'm going to set the context with this, is that we had one chance to make an impression on the FDA, and that was a 90 minutes. That's the maximum time that was allotted for the session. So we approached it with, or I did at least, with project planning with military precision along the way. 5 months of planning until the session. We set critical milestones that would measure our progress along the way. And some of these were actually dictated by the FDA engagement team. And we were in constant communication with them. They were very supportive of, I think that hosting a session can be a little bit overwhelming for patient advocate groups who have not done this before. I know it certainly was for us. But they were there to help us all along the way. So the two pieces of how we did this, and this is where I need to, I want to hear from our speakers. But the first thing I will just say about capturing the stories is that how we did that, and we did that. We tried to figure out a way that we could capture our stories, but at the same time, We wanted to be able to provide a safe space for everyone on the team so they would feel comfortable in sharing their stories, because these were very emotional for all of us. So what we did was started by doing an hour-long recording and transcripts of each speaker's journey. And then we, working together as a team, with all the speakers individually, we edited those hour-long recordings down to 7 to 8 minute scripts so that we would ensure that we had enough time with the FDA to make sure that the patient stories were heard. And then it was a case of practice, 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 and more practice. We actually conducted 3 hour-long sessions with the team so that we could become more comfortable telling our stories and go through all of the things that you have to, technical things that you have to do about mic off, mic on, and things such as that. And everyone, I think, also did some individual practices. So those are my sort of thoughts on what we did, and I'm sure that somebody else has some thoughts on what happened in this behind the scenes. If you'd like to turn your mic off and comment, that'd be great.
Hi, Lynn. This is Jerry. I want to quickly say, you know, that practice, the commitment that each person that, you know, joined the team to be a speaker or whatever role that they played, you know, everybody was just so open to, you know, really taking their time to help to, you know, get the script right. It was a big challenge when you take somebody's journey and then try to get it down to 7 and 8 minutes. And I know that we all had some struggles with that, right? So I just want to just before everybody else starts, quickly say thank you to the passion and that each speaker brought with them. Dana, you had your hand up.
Yes, hi. So the background of it, basically, the hardest part or the trickiest part for me was to really pick the most important things that happened in terms of like my disease and what I had to do in terms of getting the right diagnosis, since DM is pretty rare and a lot of rheumatologists don't really know about it. So that was something that I really wanted to like reiterate to the FDA that, you know, this is really rare, and although you don't see it in like young adults like me, you know, I wanted them to know that it can happen to anyone, and especially, you know, young adults who are just starting out their lives and stuff. What
an important point, because that's exactly, you know, part of what we wanted to show the FDA, that, you know, although the literature says, you know, happens in 40 to 60 most commonly, that doesn't mean it doesn't happen to young adults going through, you know, schooling and stuff like that, big life changes. So I appreciate that you shared that aspect.
Hi. First, before I say anything else, I want to just say I think we need to bring attention to all the work that Lynn, Jerry, and Manuel did behind the scenes too. I mean, as much as we practiced and pulled our stuff together, we wouldn't have been able to do this successfully if it hadn't been for you three, really being the conductors of the orchestra, so to speak. I think it was important for us also to let them know that doctors think they know, and this is to bring up to, I think it was Sarah that was just on, but to bring up the point that they think they know what dermatomyositis is, but they really don't. I think just everything that we showed, there were so many similarities between us, but there were so many differences between us. And I think that was highlighted beautifully by each of our stories that we, you know, were able to present to them. So I think there was a lot behind the scenes of trying to, and I think this is where everybody was instrumental in our interviews and helping us decide what we would talk about, is making sure that we covered all of those little nuances of the disease and that they were well represented to the FDA so that they realized it was not a cookie cutter approach. There is no easy approach to treating it, and that's why we need more trials. And we need more research into the disease than what we currently have.
Thank you so much, Suzanne, for your acknowledgement of the team kind of behind the scenes. Lynn and Manuel did the majority of the work, and I'll tell you, it turned out so wonderfully. And you're right, trying to pinpoint and make sure that we're telling the FDA and getting those various aspects across. It was hard, right, to try to make sure we get those. So certainly appreciate that. Melissa.
Hi, everyone. I just want to acknowledge Jerry and Lynn and Manuel, like Suzanne just said, because they were definitely patient with us. They showed us so much compassion that we were that's why we were so driven to do our best, because they were just so accommodating and understanding and supportive. So kudos to them. And if they ever ask you all to do a project, I would highly recommend working with them because they are great to work with. So I just wanted to say that first. And then secondly, behind the scenes, like I said, just working with Jerry and Lynn and Manuel, it was just really awesome to do. And then, of course, everyone else within the group, I feel like we really got a bond and understanding with each other. And as far as the different aspect, we were all supportive of each other and feel like we've connected. We'll be forever connected with this experience. And we definitely wanted to emphasize to the FDA about how, because I'm not sure if anyone have seen, because like for my particular autoantibody, the MI2, it says how it's the prognosis is great. Because I know when I was initially diagnosed, that's what my initial rheumatologist told me. It's like, oh, you have the MI2. This is not going to be that bad for you. You got the best one of all of them. Like I was, like I got a prize or something. But look at me now. I'm like deteriorating. I'm having issues. I was diagnosed in 2020. I'm still not stable yet. Still finding out more issues about my health that I didn't have before dermatomyositis. So I just wanted the FDA to know that that is not the case. And so their information definitely needs to be updated because rheumatologists are basing it off of the data that's out there, telling patients, oh, well, you have MI2 and prognosis is great for you, but it's people like me with this refractory dermatomyositis that I'm still not stable. And I'm still on high doses of prednisone and still trying to find treatments to stabilize me. So I'm so grateful to have been a part of this group to share that information with them and hoping that they will take heed to the new information that we express to them to make it better for everyone that's coming behind us. Because unfortunately, I know more and more people are being diagnosed and I just feel like if we can give them more current information, they can have a better outcome and skip some of the struggles we had to encounter during this process. Thank you.
Thank you, Melissa. Linda, you had your hand up, and then I want to also give you a little bit more context on where we're going with the results of our session that we had with the FDA. But Linda.
Hey, just two things. One, with the practice sessions, we really, a bond was absolutely developed amongst the team. And we, through our practice sessions, for the most part, we were pretty steady, not emotional, really, a little bit, but would, do our parts. And when we got to the day of the listening session, I think that for all of us, I know for me, I'll speak for myself, but the impact, all of it, all of the work that Jerry, Lynn, Manuel did getting us there, it was just all like, my gosh, we're really having a say here with the FDA. And it felt so empowering. And, who knows what impact it will or won't have, but it certainly felt like we had an impact. And a few of us got emotional that day. And I know I did. And I found this voice in me that came out kind of demanding better trials and consistent treatment that I never would have thought the person that I just never would have expected me to have that voice. And so thankful. And, after we all went back to our Facebook message group, because we just kind of all needed to decompress and be together. And I'm so thankful. And it was an incredible opportunity. So yeah, that's it. So in anything, you guys sign up.
Okay. What I wanted to say was, from my perspective, a couple of things. And Manuel and I took the lead on transcribing both from the recordings and the transcripts that we captured, to try to hone down all of that information into these 7 to 8 minute scripts. And I must say that Manuel did the majority of that work. It's unbelievable. But, we felt, and I know he felt the same way, but every time I would look at the script and he would say, here's what we got. And we knew that we had to hone it down some more, because we had to get it down to like a 2-page thing and script that then the speakers could practice and speak from. That every time I looked at a script, I came at it from the standpoint of, I have an obligation to Linda and Dana and Melissa and Fred and Suzanne and everybody, but I had an obligation to make sure that as much of their story and the highlights of their story were captured in that script. And that was probably the scariest thing I had to do. I mean, I've done projects before, and I can plan projects with military precision, but I've never done this. I've never tried to be the first line voice of a patient. And
that was so important to you, Lynn, not changing the voice.
It was,
that was so important to you.
It was very important to Manuel too, is that we don't change the voice. We kind of summarize it a little bit, but then each speaker had to bring their own voice into that with a tone and a flow of the session. And there are times when I thought, I don't think we can do this. I probably spent, based on what Manuel had put together, and my goodness, if we hadn't had him to do this. He's also the one who looked at he pretty much built the front end of our ask of the FDA and said, we would like to host a session, and this is why. All of that is mainly his words. And he's also the one who looked over the possibilities of who we knew out there who had the certain antibodies and what we needed to highlight there. The issues around the diversity of symptoms and stuff. And even on all of that, I still probably spent about 3 hours on each script, re-listening to the recordings and the transcript and his script version to figure out, had we caught everything? Were we being authentic and true to each of those speakers? I don't know that I could ever do that again, but it was not a task that I thought I would have to do before we came into this. So the learning about all of this is one of building. To me, it was a level of compassion and understanding and trust that I hope that we built with everybody who did this session, because that's the important thing, that everyone here trusts each other, that we will be careful and compassionate with everybody's story. That's what I got out of it.
Beautiful.
And I cried a lot too. So,
Manuel, what about you?
Well, I think we knew from the beginning that we wanted to do that, right? That we wanted to do an FDA listening session. We had the reasons. We have the failure of clinical trials in the past. So we had all the right reasons to do it. I just think that there was such an emotional content when you listen to the stories, right? When I was transcribing basically the story of somebody's life, like any of you, and then trying to summarize this in 7 minutes is something that you cannot make justice. But I used to listen to the recording, and when we're writing about the disease, it's like we're capturing the words of everyone and trying to present it in a way that FDA can understand, can be actually something that can assimilate of what it takes to get through this disease and what kind of treatments you actually have failures with. But it's basically a very painful process. And I think you can develop a lot of empathy through this, because you almost have to stop. Like, I used to see the recording and write something and then stop and take a walk and come back to that, because all the different hospitalizations, all the different treatments, all the different journeys is just difficult. So you want to capture that a little bit more, take your time and do it, because these are hard stories. This is the true aspect, the true vision of dermatomyositis. So it's very important to tell the story correct. So I think for me, actually, it was a very meaningful experience. I learned a lot of things I didn't know. And also, kind of, it's one thing to read about a condition or to even look at the Facebook, but another one is when you are watching and listening to the videos and understanding much better. So it's really a journey for us as well during this process, and took us a while to get to the right story, kind of get the feedback from everyone. Are we missing something? And again, going back to the editing. Editing is a bit terrible because you are cutting people's values on what they want to add, and then you say you want to reduce this. So it was a working process with everyone. Everyone was so graceful to kind of, okay, we can do it. And everybody was on time to the practices and all that. It was a little bit like a boot camp in a way to go through this process, I think. And you feel like you are, of course, I put Lynn as the general. She's directing the whole thing and said, you guys be on time for this one. So we did practice, we did all the sessions. It was really something very special. And I hope we can repeat that again in other projects with the FDA. It was great, I think.
Well, good afternoon. And I just want to say, reflecting back on our initial interviews and things, it was very sensitive and kind of hard to go back through the struggles. And I just want to say that you and Manuel and Jerry, you've done an outstanding job. Because I know when you interviewed me, I can be quite a talker, and I don't know how you were able to take all the information I shared with you, and then bring it down to this 7 or 8 minute speech, but you still caught a lot of my heartfelt points and, some of my highs and lows. And yeah, it gets a little tough, it gets a little tough reflecting back, but the team, it was just, I couldn't have made it through without the strength of each and every one of you on the panel, hearing the similarities of what we've been through. And not just what we've been through, what we got to share with the FDA is what we continue to go through, and you look well, you get that all the time, but you just don't know, behind the scenes, what's going on, the continued medications and treatments. And I think this was awesome to let us speak, tell our own story, sort of toot your own horn type of thing, but in a realistic manner to the FDA. And my good friend Jerry, I just tell you, man, I'm indebted to you. I remember when I first found MSU many years ago, lost and didn't know where to turn, what tomorrow was. And MSU has really been a good thing for me. Absolutely. Again, it was a pleasure being a part of this and sharing my story. Wasn't easy, but I just, like to go ahead and share it. And, hopefully something positive can come out of it for the FDA so we can get more research wise, medicine, whatever can come out of it. And for my fellow MSU members, if you ever get to be a part of this or anything of this, please do. This was very well ran, a very well oiled machine. Thank you. And I appreciate you allowing me to be a part of it. Thank you.
Thank you.
Thank you.
Yeah, it's it's an amazing thing when you think about it, just by, and I don't mean to minimize it by saying just, but by sharing our journeys and what we have been through and are continuing to go through. Just think of the power. We got in front of the FDA. I mean, that's amazing. You guys, I just want to highlight how powerful your stories are, your journeys, whatever you want to call them, in helping research. And Lynn puts it in a lot of our communications. Your data and experiences drive research, and this is just one amazing way that you can use your voice. And other projects. I mean, we're always looking to recruit for projects. So keep an eye out to get more involved. And if nobody has anything else to discuss or comment on this section, we're not done yet. Lynn?
So yes, so thank you, Jerry. So yes, so this is, let me say one thing before we get to this, because this is what did we learn individually. Some we've already talked about, but one thing that I want everyone to know is that it was suggested that we create a summary, and FDA has a page, and we have a link to that where you can read a summary of our session. And in that, you will find the actual scripts that we used. We don't have recordings, but our team was kind enough to give us permission to make sure that those scripts were put in those minutes. So in a few weeks, maybe less than that time, we will actually have a full script summary of what went on in that session. And if you want to read more about what the journey of each of the speakers today, you can do that, because that's an open site. It's open for everybody, public wise. Anyone who wants to hear those stories will be out there or listen to the stories. So I just like that. And so finally, it comes to the real meat of what we wanted to discuss. If anyone else has any other comments, and that is, in telling your stories, what did you learn about yourself? What did you learn? You talked a lot about the community already, but a little bit more maybe about what you learned about yourself, or the power of your voice, as Linda talked about. I think each of you has it within you to, and maybe it just there hasn't been an opportunity to put you on a stage where you can shine the way we did with FDA. But I will say this about listening to the session, that it was like a conversation across a cup of coffee with somebody, just happens to be an FDA official. But the power of, there were a couple of questions, and the responses of our speakers spoke to their knowledge about the disease and their passion about it, and a real understanding and sense of confidence that I can talk with you face to face, person to person, because I'm an expert in my disease. And that feeling to me came out very loud and clear as we were discussing the speakers and their journeys with the FDA when they ask questions. So with that, I'm sure there's somebody who might have something to say.
I think what I learned about myself by going through this process is that Lynn put it perfectly, that I am the expert in my disease. I think we get, I've run into doctors and you say you have dermatomyositis or whatever, and they kind of like, oh yeah, I know all about that. And then you go to find out that they really don't know about it. They don't know the pain. They don't understand the steps that you may have to go through in getting your diagnosis, in getting a treatment plan, whatever it may be. And by working with the panel and being able to present to the FDA, I saw that I knew who I was and that I knew my disease. And it gave me that confidence, I think, because in the past, I would sit there and go, oh, maybe am I imagining this? Or maybe this isn't really what is attributed to the disease or whatever. And when I was able to get together with this group of, amazing individuals, and we were able to tell our stories first in practice and then in front of the FDA, I think it gave me the confidence to say, yeah, I know about my disease. I know who I am with dermatomyositis. I know where I am. And this is me. And you as my doctor need to work with me to figure out what's going on. You don't need to just tell me because I do know who I am now. So I think the FDA, the community, and all of us coming together and sharing that story, I think gave us a strength as a community, allowed us to really impress upon the FDA what we need, who we are, and that we are not to be ignored. We have the power in our voice. We have needs, and this needs to be addressed. This can't be just because we're a smaller, quote unquote, smaller group with a rare disease, that it's okay to kind of push us to the side. We need help, and we need help now. And I think we conveyed that to them, with our stories. And I think that was really important. So my power of my voice is that I need to not sit down. I need to continue to stand, and, tell people what the disease is. And, and rightfully so, we're in May. And this is the time we need, it impressed upon me the need that we need to do this. So that's what I took away from the whole experience. And again, I appreciated being able to be a part of it. So thank you.
Yeah, thanks so much for sharing that, Suzanne. I love how you say that, you know who you are, that's the power of your voice, and so true. Thank you. Linda.
Dorky Linda goes now. A lot of, I agree, obviously a lot with everything that Suzanne just said. I'm going to jump out of order with the questions, but, about the community. Suzanne, as you were talking, I'm thinking about Myositis Awareness Month and hear us roar. And together, I feel like, or at least I choose to believe, that we did roar collectively and individually to the FDA. And, we left them speechless, didn't we? I think, I forget if it was Suzanne who said it, but they think that they know what our diseases are like, and we all have a lot of differences in the myositis community with our symptoms. But as we practiced, and I would hear others telling, doing their script, and I think, wow, yeah, I've had that same impact, or something like that. And so we're all tied together. And as we speak together and share our journeys together as a community, we have such power to let people know the devastating impacts that these diseases can have on us. And, you know, reading about it is one thing, but hearing us personally talk about it. With what I learned about myself ties in with the power of my voice. I already, you know, talked about it, but there were, I believe, like it was double what the estimated attend. You know, I remember they had said maybe 20 to 25, and there were a lot more than that that participated in that session. And I know even that for me was like, wow, we're really having a say. And typically, you know, that's something that would have made me nervous. And because we could see how many participants were there, but it just, I can't find the right words, but I could just feel the power of that the FDA was listening to us. And, you know, I don't know the impact it may have like on my journey at this point, but I have no doubt that what we're doing absolutely is helping newly diagnosed, and that's fantastic. And I don't mean that as like, you know, martyrhood, like, oh, it's good for the new people, poor me. Because with any luck, you know, it's going to speed up trials going forward anyway. But I'm not sure that they realized how so many of us are instantly eliminated from being able to participate in a drug trial because of a certain medicine that we would need to stop, but we don't know what would happen if we stopped that medicine. So anyway, it was so empowering and again, so bonding. I mean, I just feel so connected with this group, and of course then our MSU family. Yeah, it was such an honor to be able to participate in this.
Fred.
You know what I learned most about myself from this experience and this panel is just how strong the human being can be. You know, there were many times where I just felt like giving up. You know, at the lowest point, so weak, you can't walk, you know, little things like bathing yourself or your personal hygiene. And I think what got me the most was I'm supposed to be here to take care of my two elderly parents. And here I am, I can't even walk. You know, I really didn't think there was no tomorrow, but I really, you know, from finding MSU and some other avenues, you know, I hunkered down and just learned to take life one day at a time. And before I knew it, I was getting some sense of normalcy back in my life. And then lo and behold, one day I'm able to take care of my parents again. So, you know, it just shows if you don't give up just how strong and resilient one can be. And being a part of this panel, you know, it took me back to reflect upon my journey. And, you know, it wasn't so bright sometimes, you know, not just dealing with sickness. I had some other domestic issues and various things in life going on all at one time. And, you know, it just felt like a spiral, just felt like I was going down a drain. But to be able to rebound and be resilient and to come back from that and, you know, live a happy life now, you know, far from well, but I'm a lot better than what I was. A lot of the things that I have encountered. And what's important, you know, I helped take care of my father until he passed away at the rightful age of 95. And I was so thankful for that. You know, I got to take him to the barber shop and doctor's appointments and things of that nature. And currently I take care of my mother. She's 90. She'll be 91 July the 18th. So I thought I would never be able to do that once I got sick. And, you know, it taught me about myself, just how strong I could be, you know. Also with the community, you know, it showed me how strong the community can be. There's a lot of help out there, a lot of different avenues. And then, you know, there's a darker side of the community. The folks that look at you like, oh, well, you're fine. You know, you look fine. You don't have an impediment. You don't have disabilities. But for the most part, the community has been great. been able to get in various community things such as proclamations, for Myositis Awareness Month and the various things. It's been really good. And it's also good to know that you have that avenue to talk to big organizations like the FDA. And it's like Linda was saying, I was surprised when I looked at the number of participants that was on there. I forget the exact number, but it was far more than I expected. And then the magnitude sunk in. Wow, you're speaking and sharing your experience among some of the top scientists and doctors and, specialists. And it was just a true honor to be able to let them know in our own words, because, they know from studies and things of that nature, but no man or woman knows a rocky road unless one has walked that rocky road, so it was great. Also, what I've learned about the power of my voice, I never knew it could be so powerful. Who am I? I'm Fred Lazenby. Nobody really never listened to me other than my last name, leaves a lasting impression. People don't forget you, but getting in the support groups and the various organizations, once I got better and, got over some obstacles, I've been able to talk to some individuals who are just coming down, with myositis and various side effects and things. And, they're very bewildered, scared. And it's good to be able to say, you're going to be okay, just hunker down and it's going to be okay, and share what I've been through. And oh yeah, I've had that course of treatment. You can sort of expect this, and to watch some of these individuals who come into MSA grow and get better over the years. It's so many. I see a lot of names, and believe me, I follow everyone's story. I might not be that vocal on the sites. I got a lot going on sometimes, but I look every day to see what's going on in everybody's lives. And I feel as we're one, it's like we're all brothers and sisters in this thing, and it's just so great to be able for my voice to speak to the FDA, other opportunities, going to the conferences, which is slated to start back up here in September. Everything goes well, I'm going to be there. Being able to talk at the various seminars when they ask questions and getting your answers. But the voice is a very powerful thing, and this whole ordeal has really redefined me. It really has. It's changed me as a person all the way up and down, from before I got sick to the way I am now, and the way things are the way I am now. It's okay. It is what it is. It gets better when it gets better. If it doesn't get better, it is what it is. It reminds me of an old saying I had, shoot for the moon. If you miss, oh, well, you'll be amongst the stars anyhow. So thank you. I just wanted to share that.
That's wonderful.
It's
Thank
wonderful,
you,
yeah.
Fred. I know Dana is running short on time. Dana, what would you like to share?
Yeah, so first and foremost, I wanted to say, so what I learned about the community is that we're just like really strong people, really resilient people. And it's really admirable to see, other people be strong and, actually understand what I'm going through in terms of pain and stuff like that. But what I learned about myself and the power of my voice, in the beginning, I was very shy and very, I didn't want to talk about my disease in a sense, because I felt like if I didn't talk about it, then it's not true. And, in my speech, I said that in class, like when I went to university, I would literally just be the first one there and be the last one to leave, so no one would see me struggling. But now, when I park in like the handicap, I've gotten some looks from other people in terms of, oh, why are you parking in a handicap? Or so in that sense, I was very, very mad, but I had to think to myself, okay, there are people out there that don't understand. And so I told the lady myself, okay, let me tell you what I have. Let me tell you what's going on. And I will educate you on this, and especially with the FDA, and telling them, oh, well, you know, I've spoken to the FDA and like, this is a real thing. This isn't something that, you know, this is something that people don't really have all the time, but it's out there. And yeah, that just showed me a lot that the power of my voice has a lot of power behind it.
I would say to the MSU members, if you are asked to do something like this project from Lynn or Jerry or Manuel, do not hesitate to jump in head first with both feet, having no idea what you're even getting yourself into. It has been a wild experience. It has been a learning experience, and it was awesome because it was like I felt like they just handed me a whole circle of brand new friends, and so for that I'm so very grateful. I would also say do not follow all of your peers after you've heard them tell their stories. When I was talking to my family and saying that I was doing this, my mom kept telling me, are you going to cry? Are you going to cry? And I kept saying, no, Mom, I'm practicing. We're doing practice sessions and I'm not crying. And she would say, Sarah, you're going to cry. And I said, no, Mom, I'm not going to cry. Well, then Lynn read Kathy's story, and then I heard Dana's story, and then that was all it took. And I cried in front of the FDA. And what I learned is that that's okay, because I'll cry here too. It's me. It's who I am. This is hard stuff, and I'm not the only one that feels this way. I would say that for me personally, the power of my voice, finding that has been healing, because I think I have been suppressing a lot of things that were on the surface that I needed to face and I didn't want to. And so this has been a journey of healing for me, of recognizing that I need to grieve probably 5 years of my life that I have not just stopped and taken the time to recognize, yep, this is my diagnosis. This is what life means now. And we're okay, we'll get through it and we'll move forward. I would say that we're always focusing on the positive, which is great. We're always trying to laugh. But in doing that, I dismissed a lot of feelings that I needed to just deal with. And I would say that the power of speaking truth demanded my acknowledgement and recognition of dermatomyositis. It's not some little wimp. Like it's the disease is strong and it's out to whip us, and it requires a fight. And so for me to acknowledge and recognize that has been helpful in my own healing. And so I'm very appreciative of that, because I don't know that I ever would have I don't know that I ever would have been broken to that point that I needed to get broken to without this opportunity. And then I would also just reiterate again that we are led by the absolute best. Lynn, Jerry, Manuel, man, they wore so many different hats. They were researchers, they were planners, they were therapists, they were chief editors, they were professional timers, they were cat herders, they did it all. And they did it all with ease and professionalism. But I would say first and foremost, the success of this was because they treated me like a friend. And to have that relationship allowed for this to be successful. Because if we didn't feel that way, we would have never been able to tell our stories in the first place. So thank you all very much. I cannot express how grateful I am for being a part of this.
Wow, Sarah, thank you so much for being so open and raw about your experience and where it led you for this. You know, you are more than a friend to us. You know, we truly believe that MSU is a family. We're all equals here. You know, just because Lynn's the vice president of, you know, patient direct or of the organization, director of patient centered research, she's still a myositis patient. You know, she understands. You know, you get what I'm saying. You know, we all come to this at an equal point, and as a nonprofit, you know, we get provided opportunities to make a difference, and that's where all of our family members come in to help us succeed, and you did that, and I just can't thank you enough. Looks like Melissa's back. Hi, Melissa.
There, sorry about that. A
Okay.
nurse called me about setting up for IVIG. So I know you all understand that.
Indeed.
But yes, I wanted to say that, you know, like Sarah was just mentioning, like how me and Sarah both have children, and we have the MI2 antibody, and just how different our stories, how similar but different our stories are, and like how she's still able to work and everything. And here I am after diagnosed, I'm still not able to go back to work, and just wanted the FDA to understand the difference and the complexity. And like Suzanne said, that, you know, you all really don't know our disease like we know the disease, because it affects us all differently. And it was very emotional, and I definitely wanted to emphasize to them the mental aspect this disease have on us versus the physical. You know, everyone wants to focus on the physical, but to me, when was initially diagnosed, the mental aspect of this disease attacked me the most. And just people feeling comfortable and validated, I wanted to express that too, because a lot of us, like Sarah said, we sit here and suppress our true emotions because we're so caught up of trying to fight this disease. But I mean, my God, we're human beings. We have emotions. I mean, there's only so much we can suppress, and the reality sets in that, okay, you know, it's not normal for a 42-year-old not to get out of bed. It's not normal that a 42-year-old can't play with her 4-year-old daughter. I mean, these are things that we have to address, because it's not normal that a 42-year-old should be considered disabled. I mean, so that's my not 5-year-old, but yeah. So, you know, I wanted to really emphasize to them the importance of the mental health aspect of myositis, as far as, you know, addressing that, as well as giving, you know, making doctors aware to address that aspect. Because, you know, when we go to the doctor and we always sitting here trying to prove our case of our illness, and I just want them to be aware, you doubting us is not helping our mental health. Us having to fight to prove to you that we are in pain, that we are struggling with daily activities, is more draining, mentally draining to us. Like Fred said, we already at the edge, and here you are being a, not so much a but just being inconsiderate, not really getting the gist of what we're trying to express. And it's just making us more, you know, more mentally drained. So I just wanted, you know, them to understand that. And like someone mentioned earlier, had it not been the compassion that Lynn and Manuel and Jerry showed to us, I don't think we would have opened up and been as vulnerable as we did. And because they made it so comfortable for us. And that's why when we got in front of the FDA, we really wanted to shine and to express that, because of what we knew. They gave us confidence to be able to do that. Basically, they gave us the power that we needed, and they gave us the encouragement that we needed, that Riley, stop it, baby, that it was okay to be yourself. They never said, no, Melissa, that's too much, or no, Melissa, tone it down. They never told us that. They just like, I want to capture your voice. I want to capture this in your own words, but we have to do it in this certain amount of time. That's the only thing they said. But other than that, they wanted us to be genuine. They wanted us to share our story. They wanted us to be authentic. And that's why we were able to come across that way. And like everyone said, just listening to others, knowing that you're not alone. And it really showed that you're not alone, and the things that everyone is going through. And just the differences, like I said.
Oh,
Sorry about that. The Canosa, and I don't experience that particular condition with my illness, but it just gives you a different perspective of what everyone is going through. And just when you think that your situation is rough, you got someone next to you just going through just as much as you're going through. So it just encouraged me to keep fighting, because it's a daily struggle. I know you all know that and understand that. And then on top of having small children doesn't make it any better, because we already don't have the energy but like I said, my hat goes off to everyone that's still in the fight and is doing the best they can and having the positive attitude, because it's, like I said, it's a daily battle to have that positive attitude. And that's all I'd like to share. Thank you.
thank you, Melissa. Now I have a confession to make. When we started this, I didn't have a clue as to how we were going to do it. Did you, Manuel?
Well, you guys played it off really well.
I did, yeah.
You did not show any. You guys did not show any sweat, because like I said, we thought we were fish out of the water, but you guys were on top of it. I was just amazed with the script, how you all came back and made our words seem legible, because I know I was just all over the place.
It was sort of like, okay, our first step is to get the session, because not everyone gets a session with the FDA. You have to make a case. There's 7,000 rare diseases, so you figure out from that that the FDA for patient engagement is looking at a lot of sessions, a lot of 90-minute sessions, and from their end, it has to be handled very within certain guidelines. But the first step was, will they give us a session? And then it's a question of, okay, now what do we do? We've got five months. How do we do it? And a lot of it came together, I think, because of, I'm going to put it back to the team. Everybody, it was almost like it was an organic thing. We started with a little overview of what it's going to be. And before you know it, you could kind of figure out between especially hearing the stories, you could figure out what is our next step? How do we honor these stories, make them authentic, and also present them with compassion? But at the first, hadn't a clue as to what we had to do to make this happen the way we wanted it to happen. And I think that is a testament to this organization, this community, and to the way that we come together with love and compassion for each other. I guess it's time to call it a day, unless anyone else has another question. Yes,
Mary Altman. Altman's asked, what type of questions did they ask? And it's interesting that earlier, someone said that we kind of left them speechless because we were told up front they may or may not ask questions. They didn't ask many, but they did ask one. Go ahead, Lynn.
No, they did ask a question about clinical trials. And when the summary gets out there, you'll see that question and our responses. And that's one where Fred he was really very forceful and very knowledgeable in his response. That's that knowing your voice and using that voice and feeling confident that you can use that voice. But the reason is that the FDA, like I say, 7,000 rare diseases, they can't be expected to understand either the overview of what dermatomyositis is or adult dermatomyositis is, much less when you're at the 50,000 foot level and making decisions around things. It's hard to know what's going on the ground level. That's actually why these are listening sessions, which means that they're not there to interrupt and ask questions. They're just there to listen. And there are usually some questions, and usually around clinical trials from the standpoint, would you participate in a clinical trial, or asking Fred and I can't remember, was it Linda, somebody else about, well, why haven't you, why have you been refused? And Linda's answer was exactly what she talked about, is I can't take that risk. I need, in her case, she needs certain treatments to maybe stay alive. She's not going to risk that, going off of that treatment to be in a clinical trial where, number one, she might not be able to take the drug during the clinical trial, or number two, she might be placed in a placebo arm, which is the arm where you're looking at people not taking a drug, but taking a sugar solution and seeing how you react to that. So they have to do 2 arms. So that's a whole nother story about clinical trials. But basically, so we were told not to be surprised if there weren't a lot of questions, and there weren't, and that's okay.
Yes, and I think, regarding that clinical trial participation, some of the trials now, are allowing certain standard of care medications. So these clinical trials, as companies are coming to us earlier and earlier for feedback on clinical trial design, the more impact we can make as patient experts in helping them design the clinical trials for better success and help participation. So, those are some of the things that come up often is, the fear of having to stop the medications that you're currently on. So some do allow certain medications. So if you are interested in clinical trials, be sure to look through the criteria and ask questions. A lot of these companies have a contact number where you can talk specifically with somebody. Clinical trials, we obviously need more participation and more diverse participation in clinical trials, and we're working hard behind the scenes with pharma companies and our own patient-centered research to try and work on that. So thank you. Any other questions or final words from anyone, Lynn or Manuel, or any of the
well, I would just like to get in a promotion for our final fireside chat of the year, or the month of May, and that's the discussion on the pain study and the recent publication of our pain paper in Rheumatology magazine, or Rheumatology Journal, sorry. And that will be next Wednesday. Is that right? No, Tuesday the 31st. And if you want to know another example of the power of your voice, this is it. This isn't the power of actual speakers talking about their disease burden, but it is the power of a survey of over 400 patients in 2019 that led to a call to action, and Jerry will talk about that, but a call to action on pain and pain medications in myositis patients that led to this paper. So we'll talk about that, but the other thing that we will have there is, I call them our pain doctors. We'll have Dr. Salman Bai, who is our medical advisor, and our research partner, Dr. Abi Basham. I'm probably not saying that right, but they will be there to answer your questions about the paper in a way, and talking about the implications and how you can use that to take this paper to your doctor, the doctor that you have that is telling you there's no pain in myositis. And we'll talk about strategies there, but most importantly too, is that let's take advantage of the fact that these two experts in the field of pain will be there to answer your questions. And we'll talk about pain treatments, pain and exercise, anything that you want to know. The doctors will be there to talk about that. So I urge you to show up and learn more about the power of your voice. Thank you.
Yes, thank you, Lynn. Appreciate that and look forward to that session. So thank you to each of you who joined us today. Thank you to the speakers. Thank you, Lynn and Manuel, for putting all this together, and for everybody just doing a wonderful job and representing the myositis community so well. Keep thinking about how you can use your voice. And if you have something, get in touch. We would love to hear. Once again, thank everyone. And there goes my puppies. Have a wonderful rest of your day.